Russell, some fresh news out from the palace today, an update on King Charles's health from the man himself. Tell us about it.
Well, hi, Cara. Yes, an update from King Charles, and a welcome one as well, I think, because we hadn't heard from him since his cancer diagnosis. Shockwaves all throughout the world, I think it's fair to say, after we heard that the King was suffering from cancer. But he's expressed his heartfelt thanks for all the messages, not only in the UK, but throughout the world, that people have been flooding in to give him their support, and saying that he'd been greatly encouraged to know that his openness as well in talking about his diagnosis has resulted in so many more people seeking out information to do with symptoms and signs of cancer, and also that his lifelong admiration for those suffering from cancer and people who are dealing with cancer patients every day, not only in the health service, but for charities and helping their families, had obviously greatly increased because of his diagnosis. So, as I said, a welcome update from the King today, and we certainly wish him all our best.
Absolutely. And Prince William and the Queen, look, they've also provided updates on the King this week during their various royal engagements. Everyone seems to be very much on the same page and doing their best, so to speak, to keep calm and carry on.
Well, it's the old adage, isn't it? And certainly straight out the late Queen's handbook of keeping calm, carrying on. And I think that they have to show a united front in this instance, because it's been quite a tumultuous few weeks. First of all, we had the Princess of Wales in hospital for an abdominal surgery. She was in hospital for a couple of weeks, taking an extended period of leave. Then the King was in hospital for a number of nights for an enlarged prostate. This secondary diagnosis, his cancer diagnosis, was picked up during that hospital stay. And I think, you know, that's fair to say that that really did sort of shock everybody into thinking, gosh, the slimmed down monarchy is looking rather threadbare at the moment. But it is definitely the senior royals, like the Queen, like the Prince of Wales, putting their best foot forward. And I think that we will start to see a bit of a calming over the next few weeks. Certainly, we're going to see Prince William back at work. The Queen is taking up more engagements. And William did say during a gala last week that the royal family really appreciated everyone's good wishes, all of the support for not only his wife, but his father as well. And like I said, I think it's very much about pulling together in this instance, not only for William, who's going to be taking on extra duties, but for Queen Camilla as well.
Now, we don't precisely yet know Charles's exact condition or the severity of that condition, but we know that for the time being, it is going to impact the ability of the royal family to carry out their role. So what's next for the family themselves, for the UK and for the broader Commonwealth?
Well, I suppose it's the great unknown, isn't it? I suppose for the family, you know, as I said previously, it is about keeping calm, carrying on. No doubt the Queen is going to be taking on more duties. You know, we've got Princess Anne. She's the old stalwart, the workhorse, if you will, the hardest working royal, always topping those polls. But Prince William is coming back to work. I mean, he's had his first couple of engagements last week. It is the kids' half term this week. They've decamped to Norfolk to be by the King's side, as well as sort of taking a bit of a break from being at home. But he is going to have a lot on his shoulders. So whether he's taking extra duties at home or abroad remains to be seen. We still don't know exactly how it's going to work out. But I do think it's going to be a bit more of a sharing of those main jobs. Who will we see at Commonwealth Day in March? Will the King and Queen's trip to Canada in May still go ahead? Will the royals get down under to see you guys as well? That's in October. There's an awful lot of unknown at the moment. And I think for the King, it's about rest, recuperation, and trying to recover as quickly as possible from his ailments, as for the Princess of Wales. And I suppose these big decisions will be made in due course.